but especially, but we have Professor Ifeoma Okoye on the line today that will take us for the next 45 minutes. Then we can write our questions down because we have 15 minutes to take the question. But before she come online, I would like to share with you her profile, which I think is so amazing. She is a professor of radiation medicine, director, University of Nigerian Center of Excellence for Clinical Trials, editor at the West African Journal of Radiology, president and founder of Breast Without Spots, member of the TWG and National Implementation Committee on Cancer Control. She's also a member of the Cancer Health Fund. So welcome. Let's just put our hands together to welcome Professor Ifeoma Okoye. Welcome, ma'am.
Thank you very much. Thank you. If I can be given permission to share my screen. It's indeed my pleasure to be here. I've been with you a number of times, so I know that you're a group of very happy people, and I'm so glad to be with you.
You're welcome.
You're most welcome, Prof. Please start.
Thank you. Cancers that is so, and but that is an error because we have over 200 cancers seriously, and I'm happy that your group have joined hands in this. And the hair, excluding the hair follicles itself, which is still, vibrant, but the hair itself, which has already grown out, and then the nail itself, just the nail. But if we're talking about the breast, it will grow and extend itself beyond the area of the breast where it started. So it can extend through extensively in the breast. It can start as a very small granite-sized lesion, which you can find through certain procedures, which we're going to talk about, which is called screening. And it can extend itself either by just growth, or it can extend itself by breaking off and getting into the blood vessel, or getting into the lymph node, and either of these two can disseminate it throughout the entire body. So because lymphatic channels extend throughout the entire body, and starting from one point, it can actually extend into any part of the body through lymphatic channel, or through the bloodstream. It can get to any part of the body. So you find them in the bones, find them in the brain, you find them in the lungs. And at that time, when it goes into such structure, into such extensive HIV, AIDS, malaria, Ebola diseases actually comprise more than 60% more incidents than any of these global culprits, infectious culprits, and they are all called non-communicable diseases. And they comprise cancer itself, diabetes, heart diseases, premature degenerative diseases. Whereas you see some young people, they're already having old age diseases like arthritis, and lung diseases, like asthma. They are included. Chronic renal diseases are also included, because they are lifestyle modulated diseases. So roughly 2 out of every 3 deaths on the planet is now caused by non-communicable diseases. And the statistics continues to scale as the lifestyle refuses to be improved. And then environmental pollution, especially in Nigeria now, we have environmental pollution as a significant factor. And environmental pollution generally is reported in literature as contributing to 80% of the risk. So non-communicable diseases represent a public health emergency in slow motion. The sad thing about non-communicable diseases is that they are preventable, but they are neglected. Hallelujah. So a disease burden that kills 21,000 people globally is surely a serious public health threat to us, and it deserves any attention we want to give. I need to skip most of this because some of the things I've said has already been reflected in these statistics. And every 60 seconds, a woman dies from breast cancer. And 1 in 8 women would likely have breast cancer in life. Now, sometimes people will say that breast cancer is only represents itself in women, but that's not true. The reason why it seems to be only representing itself in women is because the size of the breast tissue is more in women, and it stands to reason that they would have more significant prevalence of breast cancer than male. But males do have breast cancer, and depending on which area, geographical area, it can, the statistics says about 1 to 3%, but some studies which were done in the north have come up with as high as 5% to 7%. That is the northern part of the country. First, we need to do something about increasing knowledge about what one needs to do concerning breast cancer. Now, there's something that is so common, around us in this country, and I'm sure when I mention it, we won't be surprised, and that is, it is not my portion. It is not my portion syndrome. In fact, one of our gynecologists actually did his inaugural lecture on, using this theme, it is not my portion. And truly, the mindset of a lot of people is that it is not my portion. Once they hear a diagnosis that they associate with a huge death rate, they want to be in denial. Everybody wants to be in denial, and it's not my portion. Late detection is the bane for the deplorable cancer mortality. Now, but this, of course, it is not my portion, is, of course, something that one could say is prevalent amongst those who are learned. But what about the rural community who do not even have health information? Nobody is telling them. Nobody is educating them. Nobody is informing them. So they are actually completely ignorant, and therefore they assign diabolical reasons to the lesions in the breast they see, or to bleeding, through their cervix from maybe cervical cancer. Even the men, when they start having signs that show them that their waterworks is not working very well, they don't even think that it might be something that needs to for them to go to the hospital. I know a man, one of my friends, who said the father used one of these spokes that you use to do knit sweater, and used it in the privacy of his room because he was a man that, because of the subtype that is found in the second one at 45 to 55. So we are not, folding our hands and saying, no, don't screen. So we actually have recommended the Breast Imaging Society of Nigeria, of which I'm a member, and I was part of putting together those recommendations. We've actually proposed that as soon as the girl child has breast, any kind of breast bulge, no matter how small, and you see that most breast bulges appear at the ages of 8 to 10 years. And so for such children, it is important for us to begin to teach our girl children how to do what we call self-breast examination. So important. So they must learn how to do their self-breast examination. And because of it, in the country that is enabling girls in secondary schools, creating breast cancer clubs in secondary schools. We've also involved the National Youth Service Corps members to move through the 774 local governments, even though we have not been able to make it quite as efficient as it ought to be, in order to ensure that this message is passed through, not only for that population, but I'm just saying this is how we are trying to create more engagement in this space. Recently, a bill was passed to include teaching early detection of breast cancer and lifestyle modulations you need to do to reduce your risk to cancer in the secondary school curriculum. And I think this is such good news, because whatever information you hand over to a child, you can be sure that the parents will get to know it. And so children can become veritable tools that we can use in this country to reduce this late detection. So over 80% of our population are ignorant about cancer, and they are totally unaware that early detection saves lives. And those that do know, they are constrained by either fear. Why not fear? The fear is because everybody that people know that have been diagnosed with breast cancer have died subsequently. We do not yet have a significant number of survivors, and even the few we have are not ready to share their stories because of the stigma that is associated with it. Some people will tell you that if people know that they have breast cancer, their children, will not be, be favorite subjects in the marriage market. So procrastination, denial, cultural and socio-economic constraints are prevalent factors that prevent and constrain a lot of members of our population from availing themselves of early detection, cancer best practices, or coming forward with their lesions. So we can see that in some of the studies that are showing us that breast cancer is expressing itself in younger age groups, and also showing us that in terms of stages, when we say stage 1, stage 2, stage 3, and stage 4, knowing what we need to know is that stage 4 is late stage, stage 3 is a late stage, stage 2 is also medium stage, and stage 1 is where you love to have somebody diagnosed. And you can see that in stage 1, only 2% were represented in stage 1, and as high as 46% in stage 3, and as high as 39% in stage 4. If you do a comparative study in high income countries, I don't know why this next slide is not showing, but this next slide was showing that the peaks I was talking about, the peaks are 35 to 45, the one of the early peaks you have, and from 45 to 55. Sometimes you find some peaks at the age of 25. Just warning us that I have some ghastly images which you may be seeing, and you can see that these are the kinds of late stages of breast cancer that we tend to find. I mean, really gory. It's really, really bad. Now, one of the things that this was a poster presentation I presented in Chicago, showing that despite that it is not deficiency of facilities that is our problem, it is underutilization of available facilities. So despite having mammography machines in the country now, still not enough, but even the few that we have are not used essentially for screening. Screening for early detection is what those mammography machines should really have a higher percentage of utilization, but we find that that is not what is happening across the country. And you tend to have patients barely coming for early detection, and late detection continues to prevail. So health and human rights intrinsically demand that we should have kind of care that we can give to our patients. Now, breast cancer is the result of multiple genetic changes or mutations. And so in breast cancer risk factors, there are two types. There's the risk factor that you cannot influence, and there are the risk factors that you can influence. So those risk factors you cannot influence are those which are, related to genetic factors and, which results from multiple genetic changes or mutations. Early mutations may be inherited, and that there are some mutations that are acquired, and those are usually due to ionizing radiation, that is exposure to ionizing radiation, chemical carcinogens, or oxidative damage. So knowing which ones can cause you those kinds of exposure to prevent breast cancer. So essentially, we have two types of mutated genes which are associated with high mortality and aggressiveness in our breast cancers. And so we have the BRCA1 and BRCA2. Some people call it BRCA. And you can actually do risk factor assessments. Right now, I just did my inaugural lecture on the 31st of August, and it's actually sponsored us why I feel that this is important information to give is that we should do done in other populations, and then we do know now in science that is not one that is utilized in high income countries is what is called personalized treatment, personalized medicine. Okay, so where it's dependent on what kind of disease, what is guiding your particular disease will be used to personalize your treatment. It's like a customized kind of treatment. So, but we are not doing enough genomic studies. It's just filtering in right now into Nigeria to be able to characterize the epidemiology of breast cancer burden in Nigeria. And breast cancer in Nigeria presents a typical picture of the enormity of cancer burden in the Nigerian. Increasing prevalence is happening, and we see it every day because right now in the UNTH where I practice, every Monday we have the breast tumor board. And there, a lot of the managing physicians and surgeons are decrying that the prevalence of breast cancer is increasing. It's affecting relatively young women, occur 10 to 15 years younger compared to Caucasians, 20. And most of our breast cancers are premenopausal, whereas most of the breast cancers expressing themselves in Caucasians are postmenopausal, with peak age incidence at 42.6 years. Few patients are above 70 years and more than 12% are under 30 years. In fact, we see it every time we go on outreaches. There's a double peak, which I've already talked about, and late presentation to hospital, bulky and scarce tumors are prevalent. So let me move quickly so that we can look at other things. There's also, we usually do what we call immunohistochemistry to type the type of cancer it is. And you find that there's the triple negative breast cancer. And right now, we also have the quadruple negative breast cancer. These are cancers, they are really very aggressive types. So the one lady that is a Nigerian, Professor Fumi Olabade, she found out that physiologically and at a biocellular level, humans are all the same. What is different is how one lives, the stress factors that is associated around your lives. And I'm sure you can all bear me witness that in Nigeria, we are experiencing the maximum stress any human population can actually contain. Now, again, what each person eats, so we find that diet actually contributes about 30 to 35% of the risk factor. Remember, I told you that environmental pollution contributes 80%. Now, not just in Nigeria, I'm talking about globally. These figures are globally. What people are exposed to, and we can look, which is the environment, and we can look at physical, environmental, and physiological anomalies and see something larger than the skin color that are guiding some of the reasons why we have. So environmental factors are of greater importance than genetic factors. So the questions she said we need to be asking ourselves, and they are research questions that are being asked, and people are doing some studies. Some are going to be studies to corroborate what is already globally known. What's in the water we are drinking? For instance, in Enugu, our water is, in Enugu where I live, our water is polluted by coal. And coal is known as one of those pollutants which can increase the risk for cancer, especially breast cancer. The food we eat, exposure to drugs and chemicals, and exposure to high fats. Now, we Nigerians, we love fatty meals. We love fried things. We love the fatty part of meat, tozo, more cow tail, all these areas, the entrails. These are all, loaded with high fats, and some of them are said to be the reason why we are having some of these increasing incidence of non-communicable diseases. So linking cancers to environment and the foods we eat introduces a need to conduct research in persons living in places with suspect water or high amounts of asbestos or lead paint. I actually looked up silver as perhaps one of the culprits, and I actually did not see a convincing study to corroborate that. How about studies on people who eat a lot of fast food or high fat food? So these are all things we need to look at. We can look at physical, environmental, and physiological anomalies and see something larger than the skin color, like what's in the water, the food, the drugs, and all that. So Nigerians, we love to eat fatty animal fat tissue. And animal fat tissue is the largest repository for residual poisons, drugs, hormones, etc. Even the animal husbandry, poultry that we are doing in Nigeria, the oversight is very, very poor to make sure that we are, working and giving hormones and antibiotics within the levels that are safe to our environments. So, okay, so we go to look at the breast and its structure. And you can see in this that the breast actually has an extension that goes into the armpit area, okay? You can see the collarbone showing us that the breast extends there. So a lot of times, extension of breast cancer into the armpit is not only from extension that goes with the lymphatic system. It's actually because there is what we call the axillary tail of the breast. So it can go there. And we find that the area of the breast that is mostly affected is the area that is referred to the outer upper quadrant. That is, if you divide your breast into 4, the part that is nearer to your arm and is closer to your head, that quarter that is nearer to your arm and closer to your head, which is the upper outer quadrant, tends to be the most prevalent area where breast cancer occurs. So you can see the structures, you can see the muscle on which the breast is lying on, which is why it is actually easy to take out your breast. And women should not be reluctant to have their breasts removed. And if after a breast removal, you can now be one of those that can afford to wear any size of breast. You can find a small size to wear to suit the dress you're going to wear for the evening, or a voluptuous breast that you can wear. They are all enclosed within bras these days. And some of the breast cancer survivors will tell you that these are the ways in which they are coping with losing their breast. So the breast itself is usually teardrop shaped, and there is breast tissue from the collarbone all the way down to the last few ribs, and from the breastbone, the middle of the chest to the back of the armpit. The reason for describing all this is because you need to know when you are examining your breast to know to the full extent that you have an expectation of where the breast tissue is lying. A woman's breast is made up of glands that make breast milk called lobules. So you can see them here, structures, tubular structures that you are seeing here. And in any of these areas, the glands, the ducts, the fatty connective tissue, the vessels, or the lymph, you can have breast cancer occurring in any one of them and then moving into the vessels and the lymph node. So we see here a description of some of the changes, some of the different breast cancer is not the only lesion you can find in the breast. There are, as I said earlier, benign breast lesions. And you can have pus in the area that is just around the nipple, which is called the subareolar abscess. You can have intraductal papilloma, and this one you'll be able to feel a lump. Now, when they say when you find a lump is breast cancer, that's not the truth. It's only 10%, 10 out of 100 lumps that you have found that could actually turn out to be cancer. The other 80% would be benign. However, how do you know which is in the 80% and which is in the 10%? You can only know through ensuring that you make yourself available to the proper healthcare provider that is the expert to handle this. Please don't go for prayers. As I told you at the beginning that I'm a minister of the gospel, but the first port of call for you should not be for prayers. The first port of call is to go to the hospital and get them to investigate you. And when you have your diagnosis, you can now come back to, prayer. Prayer is good as a complementary part of the treatment, but not as the treatment, as the sole treatment. Also, nutritional supplements. Some people will tell you, oh, nutritional supplement. And some patients have had themselves. In fact, I went for a program in Lagos last week, and some of the survivors who were sharing their story was talking about how they spent 2 years out of medical management because people convinced them immediately they got the diagnosis that nutritional supplements or different types of life to live can actually help you to bring the breast cancer under submission. So by the time they appeared 2 years later, they had already disseminated disease, which was such a pity. Whereas at that time they came early, if they had been managed at that early stage, they had a very high percentage chance of survival. Some people have survived breast cancer diagnosis 40 years, 50 years, and when they died, it wasn't breast cancer that killed them. So in America, there exist millions of breast cancer survivors, but in Nigeria, we barely have breast cancer survivors. And as I said, those who are survivors don't even want you to know they are. One lady shared her survivorship story in one of our pink balls, which we did. And immediately after she did that, somebody that retired as a high-level civil servant, her children descended on her. Why did she go and expose the family? So, what I'm talking about are realities. I'm not just making up stories. So we also have fibroadenoma. These are benign. You can have cystic breast changes as well. So you can see that the changes can occur. You see how it's developing till it fills up the cell itself. So we now look at some of the changes that you can see on the skin. I don't know if you can imagine right now, just by closing your eyes, the skin of an orange. Now, if you remember the skin of an orange, you can see that there are little puddles of dimples that is all over the entire orange skin. So that is called an orange skin appearance. And some people call it the peau d'orange. That change in the breast to form in this breast, the peau d'orange. If a woman sees this peau d'orange, this is a more developed, you see, this is definitely looking like an orange, and ballooned out, and you can see the skin is looking like an orange skin. this particular, and sometimes you may need to pinch it to have it, looking that way. But when you see such evidences or you feel a lump, don't begin to panic. Just go and do the right thing and present yourself to the oncologist. Now you can see here again another orange skin appearance of the breast. And these pictures here are representing how the lesion will start in the breast and how it can, through bloodstream metastasis or lymphatic channel metastasis, can go to the liver, it can go to the bone, it can go to the brain. I have one of my friends who is a breast cancer survivor who has been living with brain metastasis. And she says it's definitely not a pleasant thing to. So all these pictures are just showing us that it can spread to any part of the body, even the bowel, the bones, especially paired organs, the kidneys, So these are, paired organs like the breast will always metastasize their cancers to the bones. Okay, so key is early detection. Key is early detection. Mammography is the key breast imaging technique. However, if you remember that I told you that we have a peak that sometimes is 25 to 35 years or 35 to 45 years, you find that you have people that are younger than 40 years that we need to, make a diagnosis and screen them. So what can we do for such people? Because at the age of 40 is when your breast tissue, especially the glandular parts, starts involuting, as it were, and being replaced by fibrous tissue. So as long as you have glandular breast, if you do a mammography, it will show as white. That we don't call it white in radiology, but I want to call it white so that maybe if somebody shows you a mammography image, you'll understand, because there are white parts and there are dark parts. Now, those white parts are mostly predominant in the younger age group because they are still, doing their role of producing milk and all that, so that they have significant glandular tissue. But from the age of 40, those glandular tissue begin to recede and make way for fibrous tissue. Now, fibrous tissue, fatty tissue, they are black. They express themselves as black in the mammography machine. It's raining cats and dogs here and virtually drowning my voice. I hope you're still hearing me, please. Hello?
Yes, ma. Clearly, we're hearing you, ma. Thank you.
Okay. So they now express themselves as black. Now, if you imagine a black material, even a speck of white on top of a black material, you'll be able to see it. So the sensitivity of mammography increases after the age of 40, but is reduced under the age of 40. So sometimes we have a diagnostic dilemma where if we do mammography, it is very, very safe to do it under the age of 40, but its specificity and its sensitivity is very low. Therefore, we resort to other ways of imaging the breast at those ages, at women that are under 40. So what are those other ways? Now, if you remember, I have said that every woman, every girl child should be taught how to examine their breast themselves. That is called breast self-examination. Now, breast self-examination must be done at certain times of a woman's cycle. Now, if a woman is still menstruating, the first day of your menstruation is day 1. The second day is day 2, and you continue to count till you count to day 8 or 10 or 12, depending on your cycle. Some people cycle at 28 days. Some people cycle run to about 32 days, some even 34. So depending on how long your cycle, you can start your examination from day 8 or day 10 or day 12. After day 12, you start because those days when you are having your menstrual cycle, your menstruation, your breast is tender, number 1, and your breast is lumpy. So you may get, false positives. Now your breast is tender, so it might be uncomfortable, and so you may not do the breast examination very well because there's a bit of pressing down that you need to do in order to detect the lumps. So you need to do that examination at that time of that I've just calculated for you. And what do? You can do it in front of a mirror, or you can do it whilst you're having a bath. Now, the in front of a mirror is actually very imperative and that you must do. Why? Because you need to get, that's what we call breast awareness, being breast aware. Being breast aware is that you are fully aware of how your breast is. Do you have the left side of your breast usually bigger than the right side? You need to know that, and you need to note it as what is the pattern for you. Some level of asymmetry does occur so one breast could be larger than the other, but you need to know that is the left side for you that is larger than the right side, and how much of being larger is it. Then what is the position of your nipple? Is your nipple pointing out, or is it inverted? That is inverted inside. Some people have protruding nipples, and some people have nipples that are inside. So you'd note which one is your own pattern, so that if your breast, your nipple, which is usually pointing out, now begins to, dimple in, you know that you need to go and report such. Then you look at the skin. Remember, I showed us some skin changes that look like an orange skin. Some can be like redness. Listen, all these things I'm telling you doesn't mean that once you see it, you have breast cancer. No. They are just signs and symptoms that you need to watch out for. And when you're doing your breast self-examination, what you need to be looking out for. So your arms are by your side as you're looking at the mirror. Bed, your chest is bare. You are not wearing anything. So you're looking at the mirror. So you're seeing all these things. The next thing you need to do is to put your arms above your head, both arms, and you look again and see how your breasts are disposed. Then you push those arms, even though your hands are still on your head, you push from the elbow forward. And when you push forward from the elbow, you find that because the breast lies on a muscle, you've actually stimulated that muscle to, to hold that breast in a position that will show you any other minimal changes that might be occurring in that breast. Then after that, you can hold one hand still above your head, bring down the other hand, and use the other hand to examine the breast that is on the side of the arm that is above your head. Then after that, you do the examination on the other side, and you start from the base of the balls, round and round, making sure that there's no part of the breast you're missing, in pressing down with the flat of your forefingers till you get to the nipple side. When you get to the nipple, you press down the entire breast from the nipple down on top of your chest and roll your those flat fingers around. Then you use two of your fingers and pinch out the nipple and press and see if there are any discharges that are coming out from the nipple. And you do this for both sides. And then you do not only examine only the breast. Remember, I told you there's an extension to your armpits. You have to examine your armpits. And also the examination of the armpits is also to ensure that, because sometimes you find that the first point of call where people actually have a lesion that they can discern is in the armpits. So you also examine your armpits for any axillary nodes. Now, axillary nodes can come because you used a shaving stick that wasn't very sterile. It can occur because you have, a boil happening somewhere and, draining into it. So the fact that you see a lymph node in your armpit doesn't immediately translate to breast cancer. Remember that. So that is what is called the clinical breast examination, and you do that monthly. Every woman must do it monthly. If you have stopped seeing your period, that means you're postmenopausal, then you just choose a day in the month and mark it in your diary that you must do your breast self-examination yourself. Now, another thing that we are using to help women to remember is what we call the body check too. It was introduced in Chicago by a female mayor who came and found a high incidence there. And she felt that she could significantly reduce late detection through encouraging women to take a body. And they call the body means BUDDY, meaning a friend. Pick a friend, and they called it body check too. So we are also encouraging women to do that. And we have a jingle we have formed around there. Call somebody, ask them if they've done it. Have you done it? Let's put our hands together and fight cancer. You can use it for cancer because men have to check themselves. Women have to. So you're calling your friend at the date that your friend has given you, and you're saying, have you done it? Just by asking, have you done it? There she remembers and she goes to do, and then you call her again to ensure that she really did it. And men, you can do the same for your wives, and men can do it for men, for the prostate cancer and all that. Have you done your annual check? So, what causes breast cancer? Nobody really knows what causes. I've already talked about the genetic mutations and many risk factors. Our genes, family history cannot be controlled. A healthy diet and a few lifestyle changes may reduce our overall chance of cancer. Sorry, I haven't finished with screening. Now, at the age of 40, you can now start your mammography screening. When you do your first screening of mammography, the person who, the radiologist will be able to advise you when next you need to do another one, because it depends on the result that she has found or he has found. You'll be told when you should do the next one. So if you are above 40 and you've never done a mammography, please go and do a mammography. Now, if you're under 40 and you have a close relation, like a mother or a sister or a cousin or an auntie. Now, cousins and aunties are third-degree relations, and sisters and mothers are first-degree relations. Okay, now aunties are second-degree relations, and cousins are third-degree relations. Now, the higher the degree of relationship, the lower the risk factor. But if you have a mother or a sister or an auntie or a cousin, please know that you are probably in that high risk group, genetic high risk group. So you can either even go and do a genomic study, which is now available in Nigeria. You can do genomic studies to check your risk factor. And then you should be more vigilant. The vigilance means that apart from this breast self-examination and the clinical breast examination, which every woman needs to be doing, at least clinical breast examination, you can start at the age of 20 to do it. The breast self-examination can start as soon as the breast board comes up. Then that clinical breast examination will not be, you will stop as somebody who has relations that have had breast cancer. Even when you have a relation that has had prostate cancer, you should also include yourself, because sometimes it also increases the risk factor, and vice versa for the man. So what do? We usually offer ultrasound of the breast or MRI of the breast. MRI of the breast is the most specific one you can do, because ultrasound is operator dependent and it's not really a very high quality screening tool. But why do we use it under the age of 40 is the reason I told you earlier, because the breast is still showing as white in mammography, and it will cause the lesion to be occult. You won't see it, because white against white, you will not be able to see. So that means that you need to do ultrasound and MRI. But if you can afford it, MRI of the breast is the best screening tool for people who have genetic relationship, people who have family relationships that have had breast cancer. But if you are not in that high risk group, you can actually do mammography as a screening tool. But we do have people that are even in that young group who are not, they don't have any relations that have had breast cancer, and yet they can have breast cancer occurring. Why? Because they have other risks. A lot of emotional stress in a woman can actually cause you to have increased risk of breast cancer. Then obesity, and a lot of our women are now falling into that range. I don't know if you have noticed it. A lot of our young girls are obese. You see their mothers are trim, but they are so obese because of the diets. Our children and even some of us are indulging in wrong foods, Western diets. The WHO director said the major reason for increasing incidence of non-communicable diseases in low and middle income countries is because of embracement of Western diets. Western diets. You'll find all these over-processed foods, Indomie, that's the kind of thing, shawarma, processed meat, sausages are in category A of carcinogenic foods. Aspartame is used to sweeten a lot of things, chewing gum, all sorts of drinks filled with aspartame, or even with sugar. Of course, sugar will load you up and cause you to be in the obesity. Then preservatives, a lot of preservatives in tin food, canned foods, and these are the kinds of things. So over processed foods, all these increase your risk to non-communicable diseases, of which cancer is one of them. Diabetes is killing in incidence in our communities, all because of this wrong lifestyle. And then sedentary lifestyle, sitting disease. We are not moving anymore. From point A to point B, we want to enter a car. Even in your house, you're not moving. You're using remote control for everything. People are living a sedentary lifestyle, sitting disease. This is very, very important. We are all culprits, especially those in academia. Sometimes I find myself that I've been sitting for 10 hours without getting up from my seat, even though I know it is wrong. So these are the things that increase. So lack of exercise, sedentary lifestyle, smoking. Our young people inundate themselves in nightclubs with smoke, cigarette smoke. I told you that cigarette is one of the highest carcinogens that you can ever find globally. And you find that these young ones, they go into the nightclub at 10 o'clock, 10 p.m., and by 5 a.m., they are coming out. And secondary smoking causes 60% of the effect. So the person that is smoking gets 100%. So you might as well be smoking. So that, and then all sorts of fumes. And in Nigeria, we have exhaust fumes, vehicular fumes, and the exhaust of our generators. The whole environment is inundated with non-disposed refuse, biodegradable, non-biodegradable. So all these are, with the rains, of, fumes that we are all inhaling. And so that 80% of pollution that is environmental, that is causing 80% of risk factor is really very profound in our country, Nigeria. So these are all the items. So what do we do? How do we counteract all this? We can improve our diet. We can improve our sedentary lifestyle. We can replace our sugary drinks with water. Water is detoxifying. We can improve the free radical load we are acquiring through eating all these wrong foods that are causing inundating inflammation in our bodies. We can improve it by eating more of vegetables and fruits and wholesome foods. They say, go back to your local foods. We have a lot of grains, a lot of seeds. We should go to it. Acadia, few of you, I don't know my audience, so I'm speaking Igbo now. Few of you are Acadia Okwa, beans type food products, a lot of greens, vegetables. You find that this is not what people are inundating themselves. Rather, they're inundating themselves with alcohol. Alcohol, you add smoking, which is what these young ones do. They are now drinking the hardcore alcohol. It's no longer drinking wine, but they're now drinking Hennessy, So alcohol, and we are told that alcohol is one of the highest culprits for breast cancer. In fact, some authorities, some literature will tell you it increases the risk by 500%. Some will tell you 700%. And when you ask, how many glasses is safe? He said, no, nil. Any amount is unsafe. And I've never seen any usefulness of alcohol in anybody's life. Some people say it's good for the heart. But of course, liver and, other foodstuffs like that, they are also good for the heart. So why not go for the one that doesn't cause damage? Hallelujah. So anyway, I think I will need to stop so far because I've virtually covered everything, so that I'll give you the opportunity to ask questions. So some of the slides as you start asking your questions. This is how a mammography image looks, and you can see what I'm talking about. When most of the breast tissue is dark, you can spot the smallest white lesion. But when it is mostly white, like the one on my right side, you will lose the lesion. Thank you.
Thank you very much, Ma. This is time well spent. Thank you so much for your time. I'm going to be calling my co-host, Mr. Ade Shobowale, to take the question and answer section alongside with you. So, Mr. Ade, are you online? Can you hear me? Respond. Let's please go to the chat session to drop our questions and also our appreciation for such a wonderful training. Are you dropping your questions? Thank you very much, Professor Ifoma. This is, in fact, I have never attended any lecture on cancer like this before. This is very, the training was really like a young child of one can understand, and we appreciate you. On the chat box, you can see thank you, Prof. Thank you, Ma. Thank you, and everywhere. Some people are even asking, can that slide be shared? Mr. Ade Shobowale, are you online to take the question and answer session? Okay, media team, can you please contact the co-host? I don't know if did he leave the training?
Okay, if he's not around, no problem. Just take the questions and answer. Do we have anybody with questions? Though I personally want to especially thank Prof, but I want to ask a question. Apart from maybe obesity, smoking, drinking, are there things that people who are maybe genetically predisposed to cancer, are there things they can do, things they can take that will help them prevent it, not by detecting it, but completely prevent it from even happening at all?
Nobody can give you that kind of assurance because the triggers are not all known. You know, what triggers these changes. However, one thing that is coming out stronger and stronger is the fact that an intentional attention on obeying good lifestyle rules and regulations will definitely reduce your risk factor. Will definitely. In fact, there is an area of study that is called the epigenetics. Now, that area of study is looking at, apart from the mainstream genes, there are certain what we call modulating genes. And those modulating genes, through lifestyle modulation, that is when you obey good lifestyle, you can actually cause those modulating genes to convert your bad genes to good genes. And it is an area of study that is being utilized to see if they can use it to manipulate certain cancer treatments. There's been a little, some level of success with in skin cancer. Of course, skin cancer is quite something significant in some countries where their environment, dictates their skin because of the non-pigmentation, and they love the sun because they are mostly in cold climates. So extensive exposure to sun will usually result in skin cancer. So skin cancer is quite prevalent in those communities. So of course, it wasn't surprising that they put in a lot of research into that. And it's one of those that are benefiting from this epigenetics. So you can, through your lifestyle, actually make it impossible for, from the studies so far, the way it's going, make it impossible for your next generation of kingship to inherit these bad genes. It operates for diabetes. In fact, all the non-communicable diseases, these are lifestyle modulated diseases.
Wow. I hope this was recorded. I really love this answer because this is what we really even want to promote in Nigeria, where they can't afford most of the things. People can encourage people to live good or better lifestyle. I'm sure we will have a lot of people moving away from cancer. Thank you so much. I think another question related to this one, but almost the same way you've answered. Somebody asked if vegetable and water is what you need to prevent cancer.
Well, you will not put it that way, but they are good dietary, for instance, rather than take, I don't know if you saw that picture, that slide that showed you how much sugar are in the drinks. We inundate ourselves with this, showing you fumes from exhaust cars, Let me just show you, because a lot of people get shocked at their, okay, look at it. Look at the amount of sugar you are taking in just by taking a bottle of drink. And look at comparatively fruits. So fruits and vegetables. Now all these things, they cause inflammation. And they cause inflammation through release of what is called free radicals. Your normal body metabolic processes also brings out free radicals, but they are containable free radicals. Your body does not produce antioxidants. So you need to take it through what you're eating. So now what you're eating, that means that you have to be intentional about what you're eating. In the past, about 10 years ago, we were told, 4 to 5 portions of vegetables and fruits. And everybody was like, how can I take 4 to 5 portions? But now, it has been scaled up that you need to take up to 10 portions of vegetables and fruits. And you find that, how many people have the time? Have you ever sat over a whole bowl of vegetables and you are trying to eat it? You can spend 2 hours chewing it. And a lot of people are so busy. So that's why sometimes you say, okay, natural supplements that, sun-dried, because sometimes in the process of trying to create these supplements, they lose their nutrients. The only thing that doesn't lose its nutrients is tomato. Tomato has lycopene. Lycopene content increases with processing of tomatoes. So when you cook it, when you make it in stews, that's why they say men should make friends with tomatoes, because that lycopene both prevents and also enables you to heal and respond better to your treatment for prostate cancer. But watermelon also has lycopene in it. Vitamin D, which we find from our environment. A lot of us are running away from the sun. Actually, the sun was made for us. Our skin needs us to have the sun at least 2 hours a day before 12 noon. So that helps us to get in enough vitamin D that we need. And it protects against prostate cancer. And some studies are showing that it also has some protective aspect for other cancers. So, these are just some of the lifestyles that we need to be very, very intentional. So yes, water, exercise, even for dementia, there's nothing that exercise does not have a benefit of. And there's nothing that water, taking the right way, because some of us don't know how to take water. Some of us, when we are eating food, we are drinking water. That's not the right way. The right way is to drink water 30 minutes or 1 hour before your food, or 30 minutes or 1 hour after. If you try it, you find that you spend the whole day and your stomach is quiet. It's not rumbling all over the place and disgracing you, because you have done the right thing. You've allowed it to digest that food without overloading it with fluid. Just think about a liquidizer. If you cut up some onions, just a little onions, and then you put a lot of water, and you blend and blend it will never blend. It will just be rolling up and down, up and down. That's what we do with our stomachs when we are eating food and we are loading it up with water. No, water should be taken 30 minutes or 1 hour, ideally before food or after food. That's the best time. And when you are taking water, take it as a load. That way, it becomes a detoxifier as well.
Thank you very much for that insightful training.
Yeah.
We
There's
have
another
other
question.
Okay.
Somebody's asking, can one just notice breast cancer without earlier noticing any lump? That is, there was no lump before, but the breast cancer can just come up, even though the person was doing some examination before then.
Well, I will have to answer that question in a bit. It depends on what was the expertise of the previous investigation. Was it by you yourself doing your monthlies? Yes.
Yes.
You can actually miss, because not everybody is an expert. Even the experts, even the healthcare provider that has examined 400 breasts might still miss a lump in the breast. Now, it is not because the person did not do the right thing. It's because that is too small, or because the breast cancer did not express itself as a lump, but has come up as some microcalcifications. So those microcalcifications are best seen in the mammography, which is why it is good for you to go and do your mammography after the age of 40. You should try and do that, because there are definitely lesions that your hands cannot find, and the hands of even an expert doing it for you, which is now called a clinical breast examination, cannot find. So you do your mammography, and the mammography has to be handled by an expert, not just anybody. Please don't just go to anywhere and say you're doing mammography. Go to where there is a trained radiologist, and it's not even all radiologists that know mammography. So that's just the thing. So please just try and go to the right places. This is not where to be mising money. At least I don't know that any mammography, anybody is charging for mammography more than 15,000. 15,000 in a year. Is it too much? We use it to buy, what they call all these wigs we wear, and then they are shabbies. So it's affordable. Even if you go to the remotest rural communities in Nigeria, you'll see them wearing wigs. So sometimes when we are saying it's poverty, people cannot pay, it's not true. It's a mindset.
Wow. Thank you so much. Oh, somebody is also asking, what of starchy foods like eba, yam, etc.? Are they okay
All
to be eating?
yes, our complex carbohydrates. This is what they're saying. Don't go for processed foods. Now, let me explain something. You know, there's something called colorectal cancer. Okay, so the colorectal cancer actually happens because you have the amount of time the food stays in your, on transit in your GIT. So what does it do? When it stays longer than it ought to stay, it begins to interact with the mucosa, the lining of that lumen, and as it does that, it starts having some ulcerations, and those ulcerations over time, chronic inflammation, can translate to cancer. And this is because of what we call increased transit time. Now, all these processed foods, they don't give us, that's why they will tell you high fiber is good. Why? Because it gives you, see, this our swallow is the best thing you can ever eat. Me, I can eat swallow every day, every week, every month, for the rest of the year, and I'll never get tired of it. And it's the best. Our colons are, I think they are structured to accept that swallow thing. So when you swallow, you have a lot of bulk, and our soup has vegetables. Those vegetables also contribute to the fiber. So all of them together will improve propulsion. What is propulsion? Those contractions that cause the bowel to move itself. So you find that they move themselves. And if you now add a lifestyle that drinks water last thing at night and drinks load of water first thing in the morning, oh my God, you just virtually like clean out your guts every day, your colon every day. So but when you live, you're busy eating all those processed foods, that are not complex carbohydrates. Our gari, cassava, yam, local rice, those are good for us. And I can tell you, they're not the ones that will cause you obesity, even though, of course, if you eat 6 cups of gari every day, that will definitely be. But if your plate, the recommended plate of food should be made up of, if you divide it into 3, 2 parts of that 3 you've divided should be made up of vegetables. So imagine that you want to eat swallow and soup. Let 2/3 of your plate be made up of the soup, and then 1/3 be made up of the swallow. But that's not what happens. What happens is that more than 2/3, in fact 3/4, is made up of the swallow, and only the remaining 1/3 or whatever, is it 1/4 is now made up of soup. So think about it, whether you're eating rice or you're eating yam, let vegetables comprise most of it, and not meat. Meat should also be 1/3. That is within that 1/3 that is left out of the 2/3 after the vegetable, you divide it. Half of that should be your carbohydrate, and half of that 1/3 will be your protein. So that's how a healthy plate of food should look.
Wow, thank you so much. Somebody else is asking, is there any adverse effect of fertilizers, pest control sprays on vegetables and fruits? You see some women now using carbide and so many different things to hasty fruits to ripen. Somebody is asking, can this cause cancer?
Well, all these are now things that we are looking into, not because definitely all those sharp practices are inundating our systems with inflammation. So it's even, there are some people who have come with theories of how to wash your vegetables so that you wash out most of those contaminants that you have. Is it this spraying of your beans to kill weasels? And then, like you said, carbide to ripen fruits and all that. So those are also some sharp processes that we are also talking with some of the oversight agencies to see if they can look into what is happening between the farm and the consumer. What are the practices of people? Even the oil, our palm oil that is very healthy, they're reading it with dye. There's nothing that is not happening now in the food industry. There's so much. I hear that there caterers are cooking meat with Panadol. I really don't understand all these habits, but these are things that are happening, and we should raise awareness, more and more awareness. That's why I always say that this is an all hands on deck issue. Everybody needs to be part of, making this effort. It's not for one person. So our lives are in our hands, and, we can do a lot of things to reduce the inflammation that is usually the culprit, even for premature aging.
Wow, thank you so much. That is why the Happy People Group and the Power Team, we are creating this awareness. You can see all we have gained here today. Most people that were not here, I'm sure they know, they might get to know that they have really missed a lot. I hope Temple recorded this last part of questions and answers, but a lot of deep things have been revealed here that every common man, every human being is supposed to know. Somebody is also asking that she had milky discharge before and was not pregnant, and there was no cancer, but she removed a lump through surgery. But the milky discharge keeps coming back. Though she took bromocriptine, she's asked, it was prescribed by a medical doctor according to her, and she's asking that now that the milk is coming back, what does she do?
She should still go back. I mean, she see actually a gynecologist, and they should do her hormone profile, which I'm sure is why she had that bromocriptine that she talked about earlier. So she should just go for reevaluation, and they should investigate and make sure. It's always good to go back. Doctors are your friend, they are not enemies. If you see one of my flies is saying that you should make friends with your doctor. The doctor is our friend. It's not
it's not police.
It's not an og.
Oh my God. Okay, a lot of people are asking the same question, but I think you mentioned it before, how often they should do the mammograph. All the questions asking about that, above 40, you have done it twice. I think you mentioned yearly.
Yes, it's actually yearly. However, there are guided recommendations, which I would rather that it is the person which is why I said go to the right person, the radiologist, not just any center. They must have a radiologist. Now, the radiologist will be able to tell you when next, depending on the results that you have, okay? Depending on the result you have. But after the age of 40, most people, if you want to just say generally, should do annual mammogram.
Oh, thank you so much. I will just want to remark here, just like Prof has already mentioned, when you sun dry, you preserve all the active ingredients of the food. Our product from Forever Living Product that has sponsored this program today are freeze-dried, which means all the active ingredients are preserved. These methods, though they are expensive, but they are the safest and the best way to preserve the active ingredients. Most times when we want to extract fast soluble product or active ingredient, we use the cold stabilization process so we can preserve them. So we want to thank Prof. We know very well that all people that have listened today, they will take steps, and our generation, even we, our family members will be healthy, and cancer, just like she said, it's not our portion. We have to take action so that it will not be our portion. Thank you so much, Prof. I think most people here have taken all these things in. I also want us to notice that because, like she said, we cannot avoid all these pollutants. We also have detoxification packs. We have our aloe vera gel that will also help you with your bowel movement if you're having challenges. So you can, train yourself to this healthier lifestyle that I just talked about. We want you to reach out to the person that invited you here today, and we can talk to you about all the steps, and you can reach out to Prof in case you need more tests, more examinations, or more, professional advice. Thank you so much, Prof. I think the lady, if she's still in the house, will help us close up now. We have really spent a very great night.
Thank you so much. Thank you so much, the entire Happy People Grow Power team. Thank you so much, Professor Ifeoma. Thank you to everybody who spent time with us for this training. I hope you learned a lot, and I hope you take your health seriously. Please, as our mentor and leader have said, reach out to the person who invited you here, because we have a lot of organic vitamins and nutrients that you can use to maintain good health. So for now, thank you so much, and see you next time. Bye, everybody. Bye-bye.
Thank you. Bye-bye.
Bye. Thank you, Prof. We love you. We appreciate you so much. Thank you.
And I love you too.
Thank you.
Bye.
Hmm?